Hi, everybody. I'm Phil Klein, and I'm here with a very special guest. Today, we have Steve Davis, who's the former CEO and president of PATH, the Seattle-based global health nonprofit, who has been doing extraordinary work with the WHO and with many other organizations, both in the Seattle area and then more broadly across the US and internationally. As you think about the role for various different sectors of the economy or groups of individuals, whether it's employees at companies or thinking about companies and business leaders, are there roles or needs that particularly speak to what they can do, and also about community engagement, perhaps at the level of the city or a sector or the US or a country?
Yeah, let me speak to typically the kind of the role of business in these areas. I do think one way I've thought of it, and I've heard really good people talk about it, we have sort of three crises going on simultaneously now. But they kind of fit into each other with the cost. Certainly, we have a global health crisis of immense proportion, and I do think that's even most people think the worst is yet to come in terms of the numbers, particularly is the concern as we get into more low resource settings where we're in control of the virus, etc. But I do think we understand better what we need to do, and ultimately we'll get through this. The second is, of course, the economic crisis, which is quite unprecedented, that triggered so aggressive. And this is global. It's not just one place or one piece of one sector, and that actually is staggering. And we have to sort of figure. Hopefully, as we work and not get into the thing that we need to most avoid is getting into public health versus economy, but saying how do we have a safe economic strategy, and that it has a health element. But that's a very tough balance. But it is in fact a crisis which I think we probably are still in the scrum stage. We don't even know how big it is and what the steps, and we can only have so many recovery packages, etc. And then there's a third crisis, which has different variations in different parts of the world. But the emerging political crisis here that will and place that's already demonstrated, where we've seen more authoritarian leaders in some parts of the world take advantage of this and insert authority and or draconian measures, in fact, and we see variations of that and course in different parts of the world, and I think that has long-lasting impact and effect, and it's others are so important to all to manage, and will never be the same. There is in all of that, though, a big role for business, global, national, and local, partly because business. Well, let me just give you the Seattle example. I've been lucky part of this Challenge Seattle, which has a variety of large, mainly companies, but a couple of the large organizations like myself and the Gates Foundation with there, and we focused on a lot of regional issues, transportation, and then when COVID hit, I was actually at this dinner and said, "Hey guys, we gotta pay attention to this in January." And or February, and we've taken with Governor Gregoire leading that effort, have taken a very aggressive step to not only work on quickly getting into businesses in the city to start having people stay home early, and do a lot of good sort of thinking about what needs done quickly to support PPE. That was really a lot of business leadership in all of that, and I think we should get very good scores as a region for that kind of work, because not only as a big employers, but how does this affect everybody, not just large companies, but everybody, and then how do we help support people going back to work? So in terms of the governor's decisions now to go back to work, we've been working on what are good protocols, what are sort of the criteria, what the workplace, whether you're a nonprofit or a for-profit or you're a small organization. And so all of that has been really formed by good business thinkers, and also informed by all people affected. And so I think business can take really a leadership role in the kinds of efforts. Obviously, the other is we've just got to figure out how to get through this economic downturn that could last for a few years. It's the scale of the unemployment in this country and in this region is, multiples times what we saw in the 2008 recession or the post 9/11 a downturn or dot bomb downturn, and that means that it will actually extend out longer. And so, that be a lot of business leadership that's going to have to support, and citizen leadership. It's going to have to support everything from how do we rally as a community to help those most needy and vulnerable, and the amount of philanthropy and volunteerism and caring that has been demonstrated both and the country has been amazing, and we need to keep that up. But also, how do we figure out concessions are going to have to be made around policies around leave and around where we have hospitals which are going broke because there are no elective surgeries, but also we need them to be viable to have a healthy community. So there's going to be a lot of hard decisions that communities are going to have to engage on, and citizens are going to have to take some responsibility. I don't think one of the things that I'm frustrated by is people sitting on the sideline just criticizing is stepping up and saying, how can I help?
Yeah, so one of the things that I'm hearing is that in seeking this balance between addressing the medical and health related issues and the economy, a lot of people talk about flattening the curve, but I think a lot of people feel like it's been flattening my paycheck, right? And people are just
paycheck,
super, painfully suffering. When I wonder who are the health economists who are really focused on that specific challenge, so that you don't end up with people who are saying that, the only concern, in other words, creating that divergence and saying, you either have health or you have, and we address COVID-19, or you have an economy and mass deaths. This idea of either or there is problematic, to say the least. So if you're going to reach a balance, what does it look like to approach that balance so that those who are more economics focused and less inclined to care as much perhaps about the health consequences, how do they start to unify and come together from both of those sides? What does that look like to you?
Yeah, and this is where I would argue that we have to be careful to look at the trend lines and not the headlines a little. I worry that the headlines are, as always, and more so in this country, extreme on sides. And you would imagine that there were, the whole country was full of people either with AK-40s demonstrate, their right not to wear a mask versus, people that were just adamant about, staying home for the next 3 years if there was ever a germ. And it is actually, those are at the extremes. The fact is that we actually have already started. We are actually living that balancing act as we speak. We have a virus that's out there, and we're returning. People are returning to work, or returning to parks, or going to Safeway to get their groceries. I mean, we're already balancing economic and health. Obviously, there's different levers, but I think that. I think we have to be careful that we don't get on these extreme positions and find actually we need to knit this together coherently. It's not going to be elegant and it's unprecedented, so we'll get it wrong some of the time. But it's a matter of setting out what are the criteria for what it looks like to have a safe workplace, or what does it look like to have a store that can effectively work. And it's not just what the store has to do and the employees, but what is the customer's expectation. So this can't be that citizens and customers get the run of the road, and we have to come up with a sort of a different kind of social contract, and it's going to have to be very overt that if a customer doesn't behave in a certain way, they shouldn't have a right to be there, and that's and in the meantime, there are sets of things that companies and stores and others are starting to do, can do, will do as these phases roll in. I do think it also looks like a lot of education, and I don't mean just traditional education, but because it's almost gotten a little worse in the last 10 days, I think, where there was sort of a common understanding, and now there's all these, we just have to manage against let people start going into, this was never a real thing at all. If anybody, still thinks this was a hoax at any level, they're just not paying attention. I mean, to the deaths and to the probably will have 100,000 deaths or more in this country, and that's just like, it's just ignorant to think that that's not real, and it's a shame. But on the other hand, we have to be careful that people who have a strong feeling about their right to go back to work quickly, that's a fair feeling because of the economic desperation, that we're managing to create that pathway in is as safe as way as possible, and there's no guarantee that it will be fully safe. And I don't think very few public health people that I talk to, and I talk to a lot of them every day, are thinking, well, we'll ever avoid this, from happening to people. But can we create sort of a pathway that more people will be safe, and that people step up to a certain amount of responsibility. The government has a certain amount of responsibility. Employers have a certain amount of responsibility, and find a path forward. I think if you see what South Korea has done, what some Northern European countries have done, you're seeing other models work pretty well. I mean, and without all the sort of the tensions on two extremes. So I do think there's a lot we can learn from other countries as we go into this next phase.
Wow. So when we're under relatively extreme duress and stress, it sounds a little bit like, and when things are evolving and changing, as they are, it's good to sort of take a breath and maybe a break from too much headline seeking. The focus on that could be misplaced, and see ways that we can constructively take responsibility and productively move things forward. Things aren't only and always getting worse. There's a lot going on, and we need to kind of broaden our plane of possibilities, perhaps, so that we can kind of be a little bit more receptive and constructively engage with those kinds of things. Do you think that extends down to the kind of the community and the individual level, and especially as relates to our responsibility and when we communicate on social media and so forth? We're spreading what our thoughts are, every time we tweet or retweet. What are your thoughts about that kind of responsibility or set of practices?
Yeah, I think you hit the nail on the head, actually, Phil. That in the sense of, look, there's no doubt this is disruptive, and there's no doubt that this is tragic on so many levels. What's happening both on all three of these crises. On the other hand, we are a resilient people, and I say that as humans, as a species, and as a country, and as a globe. And we'll get to the other side of this. We'll be different. We'll have new tools, new thoughts, different politics will have been reshaped. But I think, but I do think I think the moment of unity is probably not a possibility in this country right now. I think it's just too extreme. But I think it's a moment to sort of converge, rather than us all be unified necessarily, converge to the middle, to sort of more where most people in this country and the world are, worried about the health of their children, worried about the health of their grandparents, worried about the health of themselves and their community, but also needing to pay the bills and go to work and, have a life, worried about mental health issues. I think that's a huge concern that's on everybody's minds. Is already we're seeing sort of the numbers of, abuse of, through the lens of domestic violence or depression. So, everybody, there's a lot going on, but I think where we need to do is I'd come back a bit more to this idea of this kind of a social compact that people in times past make in times of duress or war or other things, where, there's a certain amount of self-sacrifice that has to happen. There's a certain amount of accommodating new rules, a certain amount of adjusting to expectations. So interestingly enough, just a random, I think we think this is so unprecedented. And I grew up in a tiny town in Montana that's frankly very, for the most part, I was happened to be there in February. And I think when this started, people were like, oh, this isn't real. And they've had very little effect. But, and I think there's probably, it's a very, I think it voted 80% Trump or something, and not very, so this has not been treated super seriously. That said, there was my article that somebody sent from that same town's local newspaper in 1918 that said that they weren't allowed to have social events in this little town for about 6 months. And, sort of reminding people that these are, while yes, unprecedented on some level, we've seen this before. And even no matter where you are in the world, you're going to be touched and affected by these things. So I'm hoping that that we're going to have to struggle through this, and super number of hard decisions have to be made, and we've got to have a lot of luck on our sides on the vaccine and therapeutic side. And we we also hopefully won't see the humanitarian crisis that some people are worried about in Africa and parts of South Asia. That this really goes big there, where the humanitarian crisis could be enormous. But if we're lucky, and a lot of those things don't happen, we're already put the building blocks into recovery. We can find common ground around a set of sort of compromises that we'll have to make between civil liberties and health, and we've made them over and over again in other instances. And I hope that we'll see that sort of historical view on this.
There's a lot to keep unpacking in that. I actually had a great aunt who died in the 1918 pandemic as well. So there, we are resilient people. We have the ability to assimilate and respond to trauma, and to be resilient in the face of it. Do you see us, like leaning potentially towards some form of post-traumatic growth? Is that kind of one of the lenses that you see us responding in a constructive and forward-looking way in relation to this, as opposed to it simply casting this long, dark shadow into our future? Does adversity, is it cliche or oversimple to say that adversity builds character, at the level of a nation as well as of individuals? Are you hearing things like that, or reaching?
Yeah, I think there is some of that, and certainly, I in another life I was a human rights and refugee worker and lawyer, so I came out. I saw a lot of post-conflict horror, but also sort of that thing that does happen, where people who come through it have redefined themselves and redefined their understanding of their role as a citizen, et cetera. And so, I think there's that opportunity here for sure. I mean, and particularly because this isn't a war. This isn't their two sides. We're all against, everybody is against this virus. There's nothing good about this virus at all, and want it to be done yesterday. And so let's, put all our energy around on that. But I do think a couple things. I do think that it will continue to redefine us because we've come through things together. I actually think there's some things that even, I think I'm already hearing people say I'm a little bit nervous about going back to work because I've learned a little bit about how to slow down and how to take some steps back, and how do I keep some of that? And so even at an individual level, I think there's some of that going on. people reconnecting with families and friends through Zoom or whatever that they haven't, we see. And so it'll be interesting what sticks. I'll tell you my biggest worry. I think that there's an opportunity for a real conversation around some of these issues going into the next, after we get through the most urgent side of the public health crisis. Like what this has also demonstrated an enormous amount of spotlighting how broken our global health infrastructure is, how broken our national health infrastructure is, how that we, the richest country in the world that spends wildly more than any other country per capita on health, could be the one with the most number of cases and deaths. I mean, there's just a staggering reality to that should be a cause of deep conversation about structure and policy. And of course, there's even broader conversations about what does work look like, given that we've seen the reality of telecommuting. What is paid leave mean anymore? I mean, there could be some very important conversations. What is stakeholder capitalism? I mean, all the way to the big ones. I worry, frankly, that we are going to be in such a desperate need to get the economy turned back on as fast as possible, which I totally appreciate, that we may actually avoid some of those important conversations. And so my hope is that we don't tackle it all. We can't boil the ocean right now, but pick a few of those that we have a disciplined conversation about, and say, look, let's not rebuild let's build smarter coming out of this, and maybe that post-traumatic sort of character, I don't know if it creates better character. I hope it creates some better solutions, that people apply what we've learned and what we didn't do right and what we've seen. I mean, the disparities that are being revealed every day with this pandemic, it just is staggering, and so hopefully we can do a little bit better coming out of it.
Wow, thank you so much. Is there, what would you like to leave us with? Do you have any final thoughts as we kind of wrap up our conversation? You've given us so much already.
Yeah, I mean, first of all, I say three things. One is, despite some of the noise and the conflict, I do think that the level of commitment, of activism, of serious hard work that's going into this around the world is beyond belief. I mean, it's actually and truly beyond anything I think people appreciate, that people are really seriously trying to figure this out and making enormous sacrifices to that end, obviously both at the front line, but also all globally, whether you're coming at it from let me help you create the best app, digital application, to let me help volunteer to manage the food problem we're going to have. I mean, and so I think there is a incredible story of, back to the human character, of human commitment and citizen engagement that I hope people take to heart. Secondly, this is not a sprint. It's a marathon. We're going to be in it for a while. Anybody who thinks they're going to be over it quickly is literally not paying attention and doesn't understand how a virus works. And so, we're going to have to kind of take a little bit of a pace. We're going to have to pace ourselves and trust each other that we can do that and learn to adjust. But then I do think, my last, I've said this already, but let's hope that a few things can come out of this at the other side, that in honor of the many people that will have died and that will have suffered or will have grieved or will have worked so hard, that we will be able to sort of also say, look, okay, maybe we can fix this from not happening again, or maybe we can get better prepared next time, which we should have been this time, or maybe we can think about how health insurance should or shouldn't work differently. So I'm hopeful that those voices will also prevail.
Thank you. Thank you so much. Yes, absolutely. We hope they will prevail and have plenty more to add to the conversation. Steve, thank you so much for sharing these beliefs. For me, they've grown my beliefs about what's going on and what's even possible, and you've thrown in some new ones in there too. So Thank you so much for encouraging that and encouraging these new conversations, and for all your tremendous work in helping us to see beyond the headlines and beyond the reflexive, either chaotic or overly rigid responses. It's inspiring and important, and really appreciate you and all you're doing, and best wishes for your work ahead. Thank you so much.
Well, thank you.